Hey, what's up? It's Dr. Mike Geran from Foothills Chiropractic here in Travelers Rest, South Carolina, and I want to thank you for jumping on this webinar that I put together talking about what I do and how I help my patients. This webinar is for several different segments of the population. One is it's great for people that have never been to me before. So if you found me online, maybe you got a postcard in the mail, maybe you saw a YouTube video or whatever, this is for you. Explains what I do. You may be a new patient that just started care with my office. You're also going to get this webinar too. It teaches you what we're all about here at Foothills Chiropractic. Heck, you could even be a patient that's been coming to me for a decade or more. And this will be valuable information for you too, almost as a refresher to serve as a reminder of what we do here at Foothills Chiropractic for you. A little bit about myself, born in Detroit, Michigan. My wife, Catherine, is a Travelers Rest native. We have two boys, Jack and Ben. We are very, very busy people. My kids play lacrosse. Actually, one plays lacrosse. The other one graduated and is done playing lacrosse, so we're busy. I moved down from Michigan in 1993 to go to a chiropractic school in Spartanburg, Sherman College, and met my wife there, and we've been together ever since. So that's a little bit about me. I want to get into what I do with my patients. First thing, the biggest misconception that there is, and the biggest problem I have with the thought process that's out there, especially in our Western society, is that you have to have symptoms to go to a chiropractor. And that if you have symptoms, it's a sign that your body's not healthy. And if you don't have symptoms, that's a sign that your body is perfectly healthy. And the reality is both those are false. Because if you eat some bad Kung Pao chicken from the Chinese restaurant and you start to have vomiting, diarrhea, all the different things, that's a very healthy response, even though you feel bad. So you can feel bad and be healthy. The flip side is true. How many of us know people that guy never sick a day in his life, dropped dead of a heart attack at age 60 or age 50? Didn't seem sick, felt good, but he wasn't healthy. So the reality is we can't judge our health by how we feel. And we can't judge really anything about us by how we feel. It's just not comfortable to feel bad. I understand that. And so that's a big misconception. The other misconception is that chiropractic is a limited treatment for back pain and neck pain. And nothing could be further from the truth. Yes, people with neck pain and back pain get better in my office all the time. But people with headaches, people with asthma, people with digestive problems, babies who can't poop or nurse properly, the list goes on and on of things that chiropractic can help. So it's not just neck pain, back pain. Chiropractic helps a ton of different conditions, and chiropractic helps not by treating the specific symptom. Like I don't have a back pain adjustment. I don't have a constipation adjustment. I don't have a headache adjustment. I have an adjustment, and what the adjustment does is it balances the body, and a balanced body is very often going to take care of its own problems and heal its own symptoms. A balanced body is going to heal. So all I do is balance people, and very often their body's going to heal of whatever they've got going on. So I want to get into some specifics about how I take care of patients. One is the overarching technique that I use. It's called the zone technique, and I've been doing it, probably 5 or 6 years now, and I found it, and it's been a home run for my patient base. We got great results here before, but I feel like the zone technique has almost like just amped up how we're able to help people and how we're able to serve people. So I want to go into real quick, just kind of like how the zone technique works, but also how it applies to my patients. And we really look at it 3 different ways. So I'm going to use, for example, somebody who's got shoulder pain going into their arm. That's my we're going to use that as an example. It's the same if it's a knee pain patient, if it's a back pain with sciatica. It doesn't matter what we're talking about. So first thing we're going to do is, because I've been extensively trained in how to adjust extremity joints, so I will adjust shoulders, elbows, knees, wrists, toes, fingers, thumbs, whatever. So the first thing we're going to do is we're going to make sure that all the bones in the shoulder are in proper alignment. That's what we want to do. We want to make sure that everything's lined up and where it's supposed to be in the shoulder. The second thing we're going to do is we want to make sure, because if you've ever looked at an anatomy chart, you know that there's nerves in the neck that go down into the shoulder. So what we want to do is make sure that there's nothing that's impinging these nerves in the neck that are going into the shoulder. So we want a free flow of information from the brain over the nerves into the shoulder. That's the second thing we do. So first thing is make sure that the shoulder's lined up. Second thing is make sure that the nerves are getting from the neck all the way into the arm with no impingement and no interference. And then the third thing we're going to do is I'm going to balance the body. A balanced body is going to do, like I said before, it's going to do what it has to do to heal. So there are specific points on the back of your head. This is where the zone technique comes in. There are specific points in the back of your head. Each point relates to a different system in the body. There's 6 primary systems in the body. You have system 1 is the glandular system, all the glands in your body, your thyroid, your thymus, your pituitary, your pineal, your ovaries, they're glands too. Second is elimination, anything that eliminates toxins, skin, lungs, sinuses, bowels, bladder. Third is the nervous system, which includes all the nerves in your body. The fourth system is the digestive system. Anything that digests food and anything that assimilates or turns that food into living tissue, that's the digestive system. The fifth system is the muscular system. So all the muscles, all the joints, all the tendons, all the ligaments. It also includes balance. That's zone 5. And the sixth system is circulation. Heart, blood vessels, lymphatics, all the circulation. So those are six systems. They're all related to points in the back of the head. So what I do is very simple. Is I will be able to push on the back of your head and figure out what systems need balancing. And then there are specific spinal cord points. Depending on what system is not balanced, there are specific points in the back of the spine that we stimulate those points, we balance the system, we balance the zone, and body's balanced, and the body can heal. So we do a lot for our patients. You know, we want to make sure that everything's lined up, everything's flowing, and the body's balanced. When we do that, we get great results for the vast majority of our patients. Now, does that mean that every single thing that every single person walks in here with clears up? Of course not. That wouldn't be logical for me to say that. But we do see a lot of good things happen with our patients. And there's kind of 3 categories of things that we help. One is your traditional, what you would say traditional chiropractic, your musculoskeletal stuff, neck pain, upper back pain, lower back pain, radiating nerve into the arms and legs. So you have your musculoskeletal stuff, joint pain, knee pain, ankle pain, foot pain, all that stuff. Actually, the third one I was going to say is extremities. So you have your traditional chiropractic stuff, neck pain, back pain. You have extremity stuff, shoulders, knees, carpal tunnel, TMJ, foot, ankle stuff. And then you have your non-musculoskeletal stuff. This is where people have really no idea that chiropractic can help. I've had all sorts of different conditions that I've seen get better in my office. It doesn't mean that I've treated them. I don't treat conditions. I balance the body. But what we've seen is when bodies get balanced, I've seen tons of stuff get better. Headaches, sinus problems, breathing issues, fertility stuff, women that have horrible menstrual cramps. When the body gets balanced, that tends to get better. Digestive stuff. I can't tell you how many times parents have brought their baby into me. Baby couldn't poop. We balance them by adjusting them, and they have a blowout on the way home. It, it's staggering how many times it's happened. Again, because it's not that the baby is deficient of drugs. It's just they're not getting their body's not balanced, and that's one of the signs and symptoms of not being balanced is constipation. So we balance the body, we have a blowout. So um, now, how do I adjust my patients? So we've got the basis is the zone technique. It's what I do to balance the body. We use a specific instrument called the Polestar. If you've been here, you've probably had it done on you before. If you've never been here, if you ever come in, you'll see it. It's called a Polestar, and it's a computerized adjustment system. What we do is we can actually measure movement in the spine, and we can find areas of the spine that are not moving right, that are stiff. And it gives us kind of a 30,000 foot view of what's going on with the spine. And then we use the Polestar to specifically stimulate those spinal cord segments to balance the zone. And then we can also do a post adjustment, and we can check it again. And we usually see a lot of stiffness before the zone adjustment and much, much less stiffness, much better tone in the spine after the adjustment. And it just gives us a visual of where we were before, where we are after. It works absolutely great. I also have an instrument called an arthrostim. It's another instrument adjustment. It's not computerized, but I will also use that. We also have this thing called a vibrocussor. It's a myofascial release. It's like a big block that vibrates very deeply, and it can really help. If there's something that's just tweaked and not feeling good, we can help loosen some stuff up with that. So there's that. Now, we'll get into this because this is really the crux of why chiropractic is so important. And yes, people come in here all the time with problems, and they want help with problems, and we're usually able to help them with some stuff. But the reality is that your nervous system is the master control system for everything that happens in your body. And the better your nervous system functions, the healthier your body is. It's very simple. If you have a nervous system that's just not functioning well because of imbalance, because of whatever it is, your body's just not thriving. Your body's surviving, but it's not thriving. And what we want to do is take you from, okay, yeah, I'm having problems. So we want to help you get better. No shame in that. That's what we want to do. We want to help you get better. But the key is once we get you better, we definitely recommend you continue to come on a regular basis so that you can stay better and continue to get healthier. See, chiropractic's really about vitality and longevity and health and having a balanced nervous system throughout your life. The people that have a balanced nervous system are the healthiest people going out there. Kids who grow up with a balanced and healthy nervous system, like my boys Jack and Ben, are going to be incredibly healthy. So that's where we come into family care. We see a lot of families. I see a lot of newborn babies. This is oftentimes a family's first stop on their way home from the hospital or birthing center. They want to get their baby checked to make sure that there's no imbalance, because the birth process, the twisting, turning, the stress of being born can cause the nervous system to go out of balance. So we do very gentle adjustments on babies. It's almost like barely even putting any pressure on them. But we do see a lot of babies on their way home from the hospital/birthing center. So the way we run our office is we do a monthly membership for those people that want to come on a regular basis. It makes chiropractic affordable and easy for those people that want to do it for a long time, which is what I recommend. I think you should be under chiropractic care for a long time. Do you have to be a patient here? No, of course not. You do whatever you want, and I'll be here to serve you gladly and lovingly. But I do recommend ongoing regular chiropractic care. I go get adjusted every week. I try my best to see my wife and kids and adjust them every week. That's what I think you should do. I feel like I should offer you the same care that I offer my own family, which is getting it on a weekly basis. There's chances you'll come in here and you'll feel great. So you won't even think you need to be here. But we find stuff to adjust. We find imbalances that just haven't caused you problems yet. So, um, yeah, that's how we work the membership. So next steps, again, if you're new to this, if you're new to the Foothills Chiropractic universe, I encourage you to schedule an appointment to come in and get your first visit. We do a consultation, exam, and adjustment. If you are a new patient that just started care and you're watching this, I really urge you to, you're going to come until you're better. I get it. I really want you to consider coming after that and using chiropractic the way it's really meant to be used, which is to help elevate your health and vitality and longevity. And then I would say consider doing it for your whole family too, because everybody deserves a shot to be healthier, or a chance to be healthier. We don't do shots here. Everybody deserves the chance to be healthier. So that's my story. If you have any questions, feel free to reach out. But chiropractic is something that can change your life, and the way I practice it here, I think it's an amazing combination of healing methods that will help you live a better quality of life. Thanks for watching.